Well, hello, Southport Square residents. This is your Executive Director, Brian Hess, with another episode of Around the Square. So it's been a great week. A little gloomy outside today,
Yeah, it
a
is
little
really
rainy, but
gloomy.
the grass and the plants, they love this little bit of extra rain that we get. So anyway, to give you all a quick update on COVID-19, so the state of Florida continues to show some good progress and stay pretty low. Currently at a 2.5% positivity rate. So that's looking good for the state of Florida. Unfortunately, Charlotte County, started to go back up a little bit over the last couple of weeks. So we're currently sitting at 2.9% in Charlotte County. So we had been down to about 2.6% for a period of time. So we're still higher than the state of Florida average right now as far as our positivity in Charlotte County. The CDC, as I've shared with you all in the past, the Centers for Disease Control, they do rate each county based on what they call a level of community transmission, or how much is COVID spreading in the community. And they give a rating scale that basically is a red, yellow, orange, and then the best level that you can reach is blue. I thought it should be green, but it's blue. For the CDC, they are currently rating Charlotte County as a yellow, which is moderate community transmission, which means that they look at two factors. One is what the positivity percentage rate is, and then the total number of cases per 100,000 people. And so with those two numbers, they take that and they factor in what they feel is the number or the amount of community spread. So we're still moderate at this point here in Charlotte County. I know a lot of folks have been either wearing the mask, not wearing the mask. There's been some questions. Still, recommendation if you're indoors and if you're near other folks, masks are helpful. It is not a requirement, so we are not requiring masks for our independent living residents at this time, but still very helpful and can definitely reduce potential spread. And everybody needs to just, kind of gauge themselves, what's your level of risk if you are, extremely susceptible to illness, or if you might have a compromised immune system. Definitely a great thing to continue to wear your mask just to protect yourself. So we'll leave that up to you all as residents to decide. I hope you all enjoyed the anniversary event that took place a couple of weeks ago now. We just wrapped up last week our anniversary event celebration in our Harbor Health Center as well. So we carried the party over into the assisted living, memory care, and skilled nursing. We had a great time with those folks over there, and really enjoyed celebrating the 34th anniversary of Southport Square. Just wanted to give a big kudos again to Smita and Brenda for great events and all those folks that helped to pull that off and make it a success. And I saw some of the pictures in the paper. Had a couple of residents that looked great in the paper.
Didn't they all look
Oh my
great?
goodness, it was amazing.
I
Yes.
loved that part.
Tuxedos and just dressed to the nines. It was excellent. So, but thank you. I hope you all enjoyed that. And I know that the resident calendars are making their way around. So if you haven't received one yet, you'll probably be getting that within the next day or so. If you don't get one or miss out, please let us know. We'll make sure we get you a copy. But those are the Hooray for Hollywood Southport Square calendar for 2022. Some great pictures, and thank you to all the residents that participated in that. What a great calendar to have. So, but thank you all for making it such a fun event for us. So I also wanted to just share with you all today. I say today is Thursday. We're pre-recording for Friday, but on Thursday we rolled out our resident satisfaction survey results for those folks that came to Town Hall to hear some of those results. And thank you. It was a great crowd, and got some feedback from the group that was there. But a question came up about the hospitality promises in the Extraordinary Impressions program that we have here at Southport Square now. That was a new program that we instituted back in February of 2021 when we transitioned over to Life Care Services. And so I just kind of polled the crowd there today, and it sounded like some people had heard of it and some had not. So I just wanted to bring it back up and mention again our Extraordinary Impressions program that we do have here at Southport Square. With that Extraordinary Impressions, our goal is that, we as staff members, as a team here working for you all as residents, is that we want to leave lasting extraordinary impressions on you. And we want those to be very pointed and specific in how we make our commitment to serving you on a day in and day out basis. So we have what we call our Life Care Services, or LCS, Hospitality Promises. And there are 10 promises. We have trained every single one of our staff members that is here. All new hires that come in get training when they come here. We have done training with everybody that is already here as a staff member, and we'll continue to do annual education with our staff members. But this program with these 10 hospitality promises, I'm just going to read those promises to you. These are commitments that we make to you as staff here at Southport Square. So number 1, we greet you warmly by name and with a smile. Number 2, we treat everyone with courteous respect. Number 3, we anticipate your needs and act accordingly. Number 4, we listen and respond enthusiastically and in a timely manner. Number 5, we hold ourselves and one another accountable. Number 6, we make you feel important. Number 7, we embrace and value our differences. Number 8, we ask, is there anything else I can do for you? Number 9, we maintain high levels of professionalism, both in conduct and appearance at all times. And number 10, we pay attention to details. So with those hospitality promises, we have, like I said, trained all of our staff to make sure that they are living to those standards each day. I ask that if you don't experience that from some of our team members, staff members, please let us know. Reach out to their immediate supervisor, their director, or myself, and let us know, because we want to know if we're not meeting those standards. I would hope that you are seeing those from our staff on a day-to-day basis. And if you see somebody that has really exemplified one of these areas or multiple of these promises to you, you can put a little note in at the lobbies of each building, Gables East and Gables West. We do have our Extraordinary Impressions box, and you can write a little note that says, a certain staff member that may have gone out of the way or above and beyond and really exemplified the hospitality promise to you. We love to get those and share those with the staff. Positive reinforcement, give them a pat on the back. They also, through that, will receive what we call Extraordinary Rewards points, and they can go into a system and redeem their points for different prizes and gifts. So that being said, really want to make sure that we are utilizing those hospitality promises and that we are making that commitment to you and following through with those on a day in and day out basis. If you'd like to talk further about that or have questions about the program, please reach out to me. I'd love to share more information about it. But it is called Extraordinary Impressions, and our goal is to make sure that we are committed to those hospitality promises to you on a day-to-day basis. So with that being said, I hope you enjoyed this episode of Around the Square. Today we're going to walk through the satisfaction survey results from our survey that rolled out to the residents. It was the end of August is when you all received the survey itself, and had, I think it was like the end of August, first week in September, I believe, when those were due back in. And we'll talk a little bit about the response rate. How many people, if you recall, we were trying to get a 90% response. We didn't quite hit that, so I didn't go in the dunk tank in the warm summer months. I'm probably better off for it now that it's cooled off a little bit. But anyway, still I was pleased with the number of responses that we did have, and I appreciate everybody that responded back to these. So what I want to do today is walk through, talk about how many responses we got, what the responses were, how they came out, as far as satisfaction goes with you all as residents. And then I'm going to talk through some items that I myself, have sat down with our team, and we've talked about some next steps. Can you all see this okay? I know some of these numbers might be a little bit smaller. I will read the numbers for y'all so that you can see them as we get through this, but I wanted, as we get into it a little bit further, you'll see there'll be some bar charts, which will be a little bit easier to follow, hopefully. So first off, our responses, the total number of responses. So we did poll our IL, independent living, our assisted living, our memory care, and our long-term care skilled nursing residents, not our rehabilitation residents, because they're only there for a couple of weeks and then they move on. So it's hard to capture them in that survey process. But we did send out surveys to 355 independent living residents, 55 assisted living residents, 42 memory care family members, and then 56 healthcare residents. in the assisted living and in our healthcare, which is the skilled nursing, in both of those places, it would have either gone out to the resident themselves if they were their own responsible party, or potentially a family member if they had a responsible party other than themselves that was handling their financial situation. And you can see the responses here. So in the independent living side, we had 260 completed surveys, which was pretty good, 73%. You know, I felt that that was a good number. I would have liked to see more participation, to hear from more residents, but I also understand, you know, we did have a lot going on during that time, and we were still kind of under COVID and other things that were happening. So that being said, we did have 260 responses. And our assisted living and our memory care, you know, some of the challenges there is when that goes out to responsible parties, getting folks that don't live here on site. We have to mail a survey to them. They have to complete it. And if you recall, for those of you that completed the survey, it was 8 pages. It was a long survey. So it's a lot to ask some of those responsible parties. But we asked them to fill that out and send it back to us. And so we only had about 15 total responses between our assisted living and memory care, and only 8 responses from our health center. What we're going to go through today is just the independent living responses, okay? So we've pulled out the assisted living, memory care, and skilled nursing. Those are going over to those directors that run those areas, and they'll be addressing those with their residents. But what I wanted to focus on here was the independent living responses and what we can do in the independent living side. So essentially our objective with this survey was, one, we just wanted to assess the overall satisfaction. Some of you might recall we did sort of what we call like a pulse satisfaction survey earlier in the year. That was an electronic satisfaction survey that we sent out to anybody that we had an email address for. It had to be done electronically because it was not the full-blown survey. They wanted a quick and easy way to just pull those results up and send them back to us. I presented that information to you all as residents, and you'll probably see a lot of similar or similarities with the responses from this survey as well. The Pulse survey was just a quick, you know, how are we doing? That was a little bit earlier on in the pandemic. It was earlier this year when we had that Pulse satisfaction survey. And I know that things have changed, right? We've kind of gotten a little bit better with COVID, but we've run into some staffing challenges in our dining area. So we've definitely had some changes since then. The other thing we're looking at is tracking the movement of these measures over time. So we want to know, you know, how are we doing? This will be our first benchmark under the new process. So many of you that have been here for several years, we've done these periodically every couple of years through Brookdale, and there was a different format. This is the first time we've done it under the Life Care Services format, and so we'll be able to keep consistently with the same format year over year, with the questions mostly the same, and we'll be able to benchmark our progress and improvement as we move forward. And then we also wanted to identify the key drivers of overall satisfaction, and so you'll see in here, we can identify some things that may be impacting our scores that might bring them down a little bit, and what we can do to improve in those areas. I also, not inclusive in here just because it's a little busy, there was this whole grid chart that kind of had things that were important to residents per the Life Care Services survey company that they use. It's an actual outside company, in areas that we didn't rate so well in. So it would be a big improvement to you all to see better scores in those categories. So here's just the overall summary, just to like put it out there, make it quick and easy for everybody to see. The overall satisfaction of Southport Square is 77%. Okay, so that's the total number if you want to look at that. So I say if I look at it from my kids' perspective, that's a C. Maybe a middle to high C per the grading standards in the school system today. So, you know, a B is like 80%. Anybody have like grandkids or folks that are in school still? So I think it's like 90% to 100% is an A, 80 to 90 is a B, 70 to 80 is a C. So maybe a higher C, but not, you know, we're okay. We're not there yet. We definitely have some opportunity. And so we'll drill into this a little bit further. But as you can see it here, a couple of things. So there are 3 different questions that they kind of look at the overall satisfaction. One is, I feel at home at Southport Square. That's that top line, and it was in 81%. The second one is very satisfied with Southport Square as a place to live. That was 79%. And then the one that kind of dragged that score down a little bit would recommend Southport Square to friends and family. That was a 70%. So some things that we'll be kind of peeling back the layers on here as we walk through this. And we're going to go in and kind of drill down into some of these areas. So this is just a summary of all the different departments or categories that the survey company utilizes. So the survey company that we use is it's a company called SendSite Survey, and they do surveys for Life Care Services as well as many other communities across the nation. And so within these, what you'll see is the darker colored bars are kind of the higher rated. The lower or lighter colored bars are less of a rating. And with that, you'll see that the longer the bar is the higher rating. So if we take the top one up here, I'm just going to take this out and make it a little bit easier. If we take the top one up here, reception was a 99%. So our reception is our concierge folks. And I know many of our concierge, you all enjoy having them there. They're very friendly usually. Some of the comments that came back were just, greeting you warmly with a smile, making sure things are taken care of. And I know many times you call the front desk just to, get a question, something answered, or if there's something that you might need. They are very helpful. So they've always rated very highly in our survey results. And again, they took it this year again with 99%. Transportation and security both at 96%. The executive director, which is myself, 95%. So I gotta work on getting to reception next. That'll be my next one to tackle, right? I tell you, yeah. Accounting there at 89, plant operations at 88, resident services, which is Jerry, she's in the back there, 87 in her department, marketing and sales, 86, community life services, which is our activities and SMEDA's area, that's 84, innovative home services, many of y'all used to refer to that one as personalized living, and we changed that name in February of 2020. That is 83%. Communication, 82%. Extraordinary impressions, 81%. Our overall rating is 77%. So I just kind of want to pause there for a second, which is kind of interesting. If you look at our overall rating, which was separate questions, we're not really, in the middle of that bunch. We're a little bit lower in that scale. And so one of the things that tells me is some of these departments down here, some of the departments down here are more impactful to you all as residents. So they're not only rated a little bit lower, but it's more important to y'all to have those departments, escalate a little bit, okay? Supportive services or supportive facilities, 72%, environmental services, 70%, health center and engagement at 67%, dining at 64%, and assisted living at 55%. So we're going to get into some of the details here, but that's kind of how they all ranked. If you just look at the categories as they stand on their own, where they're at. So thoughts and ideas with you all, and then maybe have a little bit of an interactive session here to talk about, are these some of the things that you think will be impactful or things that maybe we can look at differently. So the first area, we know dining services was one of the big, topics. And as I mentioned at the beginning of the survey, there was kind of a scatter grid that said things that would be big impact to our residents, but we may not have rated very highly on. Well, dining services was the number one on that grid. So we know that we have to focus on dining services. And again, some of the things, the comments that I read in the overall comments at the end, specifically stated things like, I would recommend it, but I don't like the food. So those are some things that we want to work through. And by the way, just so people know, because the comments that come across, I do see those comments. I do not see them associated with this survey. So just so you know, it is a very confidential survey. I get a report back from the company that administers the survey, and all they send me is the comments. That is it. They just extrapolate what's in the box,
If they couldn't read it, it actually says, unidentified word in there. So some of them I have to read through and kind of figure out what they might have been trying to say. But I do get the responses. It's just a roll-up in a report that comes back to me, along with the other percentages of where we linger or where we ended. So dining services, the three items. So the selection of the menu items was one that we rated low on. So we've got to get a little bit better in our menu chats and making sure that we have a good menu set up. The temperature and the taste of the food were rated very poorly. Those were the last two items on there. So we have to work on making sure we have good temperature and good taste. The dining room reopening. So I put this one in here based on comments that were in the overall comments section, and that goes into that overall feeling of dining services, making sure that we can get those dining rooms reopened. So that is a high priority for me currently. And then the bistro and the bar reopening, because again, that bistro was rated at a 37%, right? Nobody can get in there, it's not a great rating. So we want to make sure that we get those reopened. So those were some of the areas, next steps in our dining services that we are, those are key areas that we've identified to focus on. In the environment side, so if you remember, environment was one of those that was improvement area, category, the second on the list. So as I read through a lot of the comments on the environment, the number one response was about the Gables East building. That was the number one. Now remember, we did this in August, and at that time we had not announced that we were going to be moving forward with the Gables East renovation this year. And so with that being said, that was still a very high priority. We do have the Gables East renovation in the works, which is excellent. We have $3 million. They are actually rolling the $3 million so that we can start spending this year and continue to spend into next year. We have a lot of the design layout kind of there. We've actually had it out to bid with several construction companies. So we're working through that progress, and it's moving quickly. The second component that I read in the environment category was the pool and the spa not being so great right now. And many people have seen, the slippery tiles in the deck area. The inside of the pool is starting to get chewed up and everything. So we do have the renovation in our pool and spa is in the works right now. We have ordered all of the supplies. The pavers, which will be that deck, there was a 16-week lead time on pavers right now. So when we talk about the supply chain and just kind of holding things up, those pavers are en route, and as soon as they get here, we'll start working through that renovation. That will take our pool down for a period of time for them to resurface the inside of the pool, lay the deck. So we will have the pool out of service for a little bit, but when it's done, it's going to look very nice and finished again. The third item on here, environmental services. So this is housekeeping, and we saw the ratings in housekeeping were low as far as common area cleanliness, apartment cleanliness. I hear both sides of that. Some folks absolutely love their housekeeper and think it's wonderful. We have other folks that say it's not good, and I clean after my housekeeper when they come in. And so a lot of that is consistency in the quality of our housekeeping staff and making sure that we have consistency across the board. So the areas here that we really have to focus on, cleaning common area spaces, apartments, vinyls, and windows, which were both noted in that survey comments as well, as far as folks not being able to get their windows cleaned, not being able to get their vinyls cleaned. We have run into some difficulties with window cleaning this year and getting vendors. We actually had a vendor that was scheduled to do window cleaning. And then with COVID, they ended up, COVID went through their company, unfortunately. And so they backed out on us at the last minute, and we had to work to find another vendor. It was a vendor that we used to use year after year after year. And so we now have a new vendor that is going to be doing the window cleanings for us, and it's great. They're a little bit more of a national level firm, has a little bit more of the manpower and labor and support that's going to help us. But we've got to get caught back up with that schedule. At the same time, we've spent a lot of time on our common area cleaning with COVID, and we've also spent a lot of time in our health center with our ultraviolet light machines and our electrostatic sprayers. And those, unfortunately, they're great pieces of equipment. and they really help us to fight COVID as we've been working through this process. But unfortunately, it takes a lot of manpower and labor to run those items. So if anybody's seen that ultraviolet light machine in progress or in the works, that is a great piece of equipment, but it's time. So it's usually in any room that you put it in to disinfect, it takes about 30 minutes to run. And so we do have the ability to turn it on and leave it for a little while, but we do have to go back and check on it and make sure nobody goes into that room. So it does take a little bit of extra time, and we're refocusing our environmental services and housekeeping team to make sure that we're back on the appearance and the cleanliness of the areas while we're also still trying to work through that disinfecting process with COVID. And then the last piece on this environment is maintenance, work order satisfaction, and touch-up painting in the building. So there is two pieces to that, and again, kind of reading through those comments that were left, as well as seeing the ratings in our survey results. One specifically was the satisfaction of the work orders being completed. Do they get completed timely? Do they get completed to your satisfaction? And so we have to look at that and how we're going to gauge that. We'll have to figure out, I know we can pull how quickly we get those done, but we got to figure out how we get satisfaction results back from y'all as far as how well we've done in those work order completions. And then the touch-up paint in the buildings. So there was several comments about just things needing to be touched up in a lot of areas, baseboards, doors, especially our service areas and our entrances and exits. They get banged up a lot, and we know that that's just a continual spot that we have to be able to go back and touch up paint. We are seeing, and you might notice in some places where you can see where they've touch up painted with something, where you can see like on the wall there's a little spot that doesn't match 100%. So right now, it's kind of an interesting deal with paint, but we are not able to get all of the paint colors and all of the paint sheens that we normally would be able to have access to. And that, again, has to do with stuff being produced and manufactured and getting to all the different areas. So we actually have found that in some instances, we have to call different regions in the state of Florida, even though it might still be a Sherwin-Williams paint store, we have to call a different place to find if we can get that color or sheen of paint that we need. So that's been a little bit of a challenge for us in touch-up painting in the buildings, is just getting
Ladies and gentlemen, I'm here with another creation from Don Baldwin. Today, he made a naval destroyer, right? Is that what that's called?
Mm-hmm.
A destroyer.
Yeah.
Yeah, look at that. And it's all made of wood. This thing is heavy. I don't know how... Have you tried it in your bathtub yet?
No.
No? See if it floats.
Don't have a bathtub.
Oh, this is pretty neat. You even put a gun on the front here. It's got the antenna mast, torpedoes, and a helipad for a helicopter. But isn't that pretty neat? Don, how long did it take you to make this?
A week.
A week. Okay, and this was again something
Well,
one of those...
off and on, but I mean, I was a week.
Yeah, you've been tinkering with it.
Yeah.
But these came with plans, and you just took those plans and fabricated just like the others, right?
Mm-hmm.
That's pretty darn neat. And you don't plan on painting it or playing with it in the bathtub?
No.
No?
No. I don't have a bathtub.
If you did, you could take it in the pool.
Yeah,
There you go. See how it goes. There's a bathtub battle in there. But that's pretty darn neat. And wow, this has got to be at least your 7th or 8th project that you've shared with me. You're on a roll.
14th.
14th. What have you been hiding from me? Wow, well, that's wonderful. I'm glad you found such a great hobby. Thanks for sharing, Don.
You're welcome.
So, Don, I found out today from Smita that there's going to be a bazaar in Town Hall on December 1st. So,
Great.
and I'll put out another, I'm sure Smita will put out an announcement too,
Yeah,
but
okay.
December 1st, all those little toys that you've been making, you can put those out if you want to sell them.
Okay.
And if anyone is interested, things like this and other items are going to be in that
Well, if they
bazaar.
want, they can give me a call now and let me know.
Yeah, if they're interested now before December 1st, they
Yeah.
give you a call. All right, awesome. Thank you.
Okay.
All right, we're here for Brian's birthday.
Happy
Happy birthday, Brian. You ready, guys? This is your birthday song. It isn't very long.
Give it up for Brian, everybody. It's Brian's birthday, everybody.
Birthday, Brian!
Happy birthday, Brian. All right, everybody join us in wishing Brian a very happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Brian. Happy birthday to you.
Kate wants Brian to dance. This is good. Get him, Kate.
She wanted to dance. I'm telling
Oh,
you,
boy.
Steve likes to
Here
dance.
we go.
Not me.
Oh, she brought the party to you. Look at
In my
that.
See, you know.
Just stand there, she's making you look good.
Yeah,
I know.
that's right. She made you look good.
You better be good. You're a Scorpio, buddy.
This is the best I do.
You're
You
good.
make it work, right? You see how good I am at this?
Oh, you're a great dancer.
Thank you. Thank you so much. I'll try not to drink it all at one time.
Is Miss Lariah giving out beers?
She's giving out beer.
Oh,
yes.
nice. You're giving out beer?
I'm going to get my beer today on my birthday.
But there's no alky in it.
Thank you.
I'm going to cry.
Oh my God, you're so young, you could be my grandchild.
We have room for one more couple up here.
Oh, look, the Bobbsey twins are here. Look at the Bobbsey twins. Oh, look how cute you guys are. Was that on purpose?
Hey, there's one more. You can
Oh, how cute. That's good taste. You guys look adorable. Oh, very
Which way to go? Will I grow? Which way to go? Will our love grow? Are you sincere?
Morning and I wonder why everything's the same as it was. Well, I can't understand.
Leave it on the beat. I want the beat. Oh, zip up. Close it up. Zip up. Get it, get it. Get it, get it. Gotta see the wall. Gotta see the wall. Over there. Nobody. 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 Nobody cares for me. Like a river flows surely to the sea. Darling, so it goes. Someday, coming to me. Take my hand, take my whole
Woo-hoo! And the music just soothes my soul. Get with her, Karen. Hey!
Crazy little thing called love. With this thing called love, I just can't handle it. With this thing called love, I must get round to it. I ain't ready. Crazy little thing called love. 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 Crazy little thing called love.
Buzzing in the Oreo, rocking the tree down all day long. I've been popping just singing this song.
Paulina!
Birds on jaybird tree,
Love to hear the robin go.
tweet, 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 rock and roll. Tweet, tweet, rock, rock, rock and roll. Tweet,
Wait.
tweet, roll, rock, 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 really go. Tweet, tweet, rock, tweet, tweet, so much. Are you still mine? I need your love. Gotta speak your love.
In Mars, in other words, hold my hand. In other words, darling, kiss me. Fill my heart song and let me sing forevermore. You are all I long for, all I worship and adore. In other words, please be true. In other words, she loves you.
Well, I hope you enjoyed this episode of Around the Square, and I hope you have a wonderful week. And just as a preemptive, I hope you all have a wonderful and happy Thanksgiving.
Hey, Brian, got a joke for you.
All right, what's the joke this week?
All right. Why did the cranberry turn red?
I have no clue.
The cranberries turned red because they saw the turkey dressing.
All right. Have a wonderful week and happy Thanksgiving, everybody.
These are terrible, but first of all, did you dress your turkey?
Sure, I did. Yes.
What color is the dress?
It was blue. I put face masks all over him.
Okay, here's the real joke.
Okay. And he was, or she, I guess, was wearing a blue dress because I don't think we want to see a male turkey in a blue dress. So, oh wait, time out. Can you stop?